Hi, I'm Rick Reef, and welcome to SoCal Insider. Well, the critics of Obamacare are on the attack, and many of its supporters are on the defensive, even running for cover. But not Ed Hernandez, the state senator from East LA, who also happens to be a doctor, has championed the cause of the uninsured even before there was an Affordable Care Act. And he's not backing down now. Hernandez is here to explain why Obamacare is good for his constituents and for California. But first, a potential setback for cops throughout the Southland in their battles against gangs. A federal court has ruled that in one crackdown, the Orange County DA violated suspected gang members' civil rights. David Nazar, what's the story?
Rick, for years, law enforcement authorities have been fighting gangs with injunctions, controlling where gang members can gather, what they can do, even what they can wear. Well, dozens of gang injunctions are in place in LA County, for example, and about a dozen in Orange County. In 2009, Orange County District Attorney Tony Rackauckus and the City of Orange Police Department filed an injunction against more than 100 people suspected of belonging to the Orange Barrio Cypress gang. Well, when about half those folks showed up in court claiming they were not gang members, the DA simply dismissed them from the case. A legal maneuver that still enabled Rackauckus to get the injunction against the gang itself and then to again target the 50 or so people who had been dismissed. That's when the ACLU stepped in, claiming those suspects had been denied due process. Now a federal appeals court has agreed. It is a decision that could impact the way law enforcement targets gangs throughout the region and could cost Orange County taxpayers more than $3 million. For years, the ACLU questioned the manner in which District Attorney Tony Rackauckus and local law enforcement agencies imposed gang injunctions. They've used nuisance abatement orders to rid neighborhoods of gang activity. The DA would use the orders to target a neighborhood with gang members and prevent them from engaging in certain activities, both legal and illegal. For instance, no violence, drug use, or intimidation, or it can be as simple as not wearing certain colors, associating with certain people, or being out past certain hours. This is a common practice by prosecutors that's been in use in California since the 1980s. The ACLU spent almost $3.5 million on behalf of the accused gang members, fighting Rackauckus and the City of Orange in court, claiming the injunctions violated their right to due process.
At its very base, fundamental level, this is a constitutional issue. If I'm accused of committing a crime, if I'm accused even of murder, the Constitution gives me the right to go to court and defend myself and say, I didn't do it if I didn't do it. There's no reason it should be any different with being accused of being in a gang.
The Orange County DA's office, in good faith, filed these lawsuits, and we're following the procedures that we believe were in place and were constitutional. We respectfully disagree with the court's ruling, and we feel it's unfortunate that basically the only thing that this court ruling did was line the pockets of folks who defend gang member rights with the tune of $3.2 million of taxpayer money, and we think that's extremely unfortunate.
The DA's office has been defiant of the appeals court ruling. Since the case, it has implemented 6 more gang injunctions in 4 different cities throughout Orange County, citing the method as a tremendous crime deterrent.
We believe that gang injunctions are one of the most effective ways to go after gangs and to keep the quality of life for those folks who have to suffer from these gangs in those neighborhoods.
Why do you believe they're so effective?
The proof is in the numbers. When you have these gang injunctions, the violent crime rate goes down dramatically. The call for services, people who feel empowered to call the police, they go up, and the statistics are there.
In theory, are gang injunctions a good thing?
They certainly deprive people of their liberty. They're deeply intrusive into people's liberties. But when trying to fight crime, you can't cast such a wide net that you don't give innocent people the chance to prove that they're innocent.
There are crime stats across Southern California that do show that crime does decrease with these gang injunctions.
I don't necessarily doubt those numbers. That may be accurate. Of course, you could see crime decrease through any number of draconian, unconstitutional measures. The question is, how do they go about doing it?
Are you defending gang members who, quite frankly, don't deserve defending?
Far from it. First of all, everybody has the right to be defended. That's a fundamental principle of our court system. But more than that, we're defending the people who want to say that they're not in the gang, that the DA got it wrong, that the DA can't sit up on high and say you're in a gang and that be the end of it. We're defending the folks that want to be able to say, I'm trying to find a way out. I live in this neighborhood where the gangs are, but I'm not in the gang. And we're defending those folks.
And Rick, you heard right. The ACLU is due $3.2 million. Now the question is, of course, exactly who's on the hook? The county, the city of Orange, or both? Well, I put calls into OC supervisors Todd Spitzer and Sean Nelson, and they aren't responding to this issue, although the city attorney for Orange, Wayne Winters, told me it's unknown exactly what the split could be between the county and city. It could be 50-50. Of course, they're looking into it, Rick.
You know, David, I understand the ACLU's argument on this, and I have to agree with them that, people are entitled to due process, even if it means it's a little harder to combat crime. But $3 million, you got to give me a break. I just don't buy that the ACLU actually spent that much money on this
Well, look,
case.
hold on. That's what the ACLU was saying. Remember, the court case was only about 2 weeks, but this began back in 2009. So they're talking a few years of legal fees, experts, witnesses. That all added up. And in the final analysis, they said, yeah, it was $3.2 million. And the judge ruled that those were the bills that are now due the ACLU.
Yes. Okay. Well, I just don't buy it, David. Okay. But how will this really hurt the attempts by law enforcement to control gang activity?
Well, remember, it's not necessarily the gang injunction. As Susan Schroeder, who you saw in the story, explained to me, it was almost a technicality. It was the way it was carried out, that these folks that were suspected, alleged gang members, they were not sort of given their day in court, their due process. So it's the injunction that's really not unconstitutional. I suppose it's the way you carry it out. And whether it's defiance or whether the OCDA believes this is really the best way to fight gangs, they say they're going guns a-blazing, they're not going to stop. And when I do talk to some of the neighbors in the streets out there, whether it's Anaheim or Garden Grove or these stories I've covered, not to defend the DA's office, but the neighbors do sometimes say, we feel a bit safer knowing there are injunctions and gang members aren't walking the streets. That's what I hear.
Yeah, and I think practically speaking, I mean, I'm not. We'll have to hear from criminologists and those folks and see, what they say. But it seems to me that this could be really tough now, because in the past, you want to crack down on a gang, you round up a few of the usual suspects, some hardcore gang members, you get the injunction, then you can start cracking down on everybody. Now cop stops them, they say, hey man, I'm not part of this gang. You're going to have to take that person into court. I could see this really being tough on law enforcement. Anyway, David, thanks very much. And now, here to discuss Obamacare and more, East LA optometrist and California State Senator Ed Hernandez. Great to have you on, Doctor.
Well, thank you very much. I appreciate it.
Do you prefer being called Senator or Doctor?
Either one. Call me, and you can call me Ed. It's fine.
Ed, and I also heard that you are known by a lot of people in your district as Dr. Ed.
Dr. Ed. A lot of people call me Dr. Ed.
Speaking of your district in the San Gabriel Valley, you've got a lot of jurisdictions.
Yes, I do.
Tell me how many roughly, and give me 3 or 4.
Well, I mean, start from the northeast. It's Azusa, Covina, West Covina Industry, Baldwin Park, La Puente, Duarte, Rosemead, Monterey Park, and all of East LA, Lincoln Heights, Montecito Heights, and El Sereno. So it's pretty much the heart of the San Gabriel Valley.
That's a lot of chicken dinners and taco dinners that you imbibe in.
A lot of city council meetings, a lot of chambers of commerce, just a lot of constituency work. But I tell you, I absolutely love what I do. I love being a public servant.
Great. Before we talk about Obamacare or the Affordable Care Act, your thoughts on this report we just had about crime, because you do in your district, gangs are a problem, are they not? And how do you read all this?
I mean, it's a problem in every district, and of course the constituents that I represent obviously want public safety as a high priority, and I think gangs are a problem. And I think if DAs or cities or entities are going to go after them, the absolute most important thing is that those individuals have due process and they do not violate their constitutional amendment, that they should use every means possible to go after them, but make sure they do it the appropriate way.
Are your constituents more concerned, because there's always talk about in some Latino communities, they feel the cops are not on their side and that they're, but do you get more that people are concerned that the cops are overreaching or being too hard, or that we want these gangs controlled?
I think it really depends on the community. I think in my district, most of my constituents trust the police officers because they have a great working relationship with the various prospective cities, with the constituents, and they know and understand that they're looking out for their best interest. Maybe some parts of LA may have a little bit of a different history, but I think in general in the San Gabriel Valley, most of the cities I represent feel very safe and comfortable with their police officers.
Let's talk about Obamacare, or the Affordable Care Act as it's often referred to. And you are not, you are, first of all, I can't think of a better person to talk to. You're a doctor, you're an optometrist. You are the chair of the Senate Health Committee.
Correct.
And whether you go to Wikipedia, your website, wherever, you have made health coverage for people. You've said it's your number one priority. So tell us, with all this stuff going on, how do you feel about the rollout so far?
Well, I mean, first of all, I feel like I am in the absolute right place and time in history of being not only a provider, but being chair of the Senate Health Committee as we implement the Affordable Care Act. I honestly believe that the success of the nation in the implementation of the Affordable Care Act is going to be dependent on the success of what happens here in California. But more importantly, it even boils down to the success of LA County, but predominantly the Latino community, because it makes up such a large portion of the uninsured here in California. California is light years ahead of the rest of the country. The first to have an exchange, the first state to do the 10 essential health benefits, the bill that I ran a year ago. Held special session this year that the governor called, signed all 3 of our bills: patient protection, Medicaid expansion, the bridge. California is going to set the standard, and if you look at all of the insured throughout the entire country, over a third of them come from California, and the rest of the country is going to look at us, and we're going to lead the way.
Even saying that, though, maybe the signups now are up around 50,000 or something, that 50,000 people have gone online. In California, something like more than 1 million people in California have gotten notices that their insurance policies have been canceled. I mean, so even though California is doing better, it still seems like, wow, something isn't working here.
Well, I think the biggest mistake, and I support the president 100%, that he made was when he said that if you like your insurance, you can keep it. I think what he should have prefaced is, if you like your insurance and it meets the minimum standard and you're not being sold junk insurance, then you can keep it. But when we sign that into law, it's going to guarantee that everyone's going to have comparable coverage. The individuals that are getting denied right now, they are being sold junk insurance. Did you realize that in the United States of America, the #1 reason for bankruptcy is individuals who have medical insurance that don't cover enough because they get a catastrophic disease or condition?
But not all of those are junk, right? And aren't there some people, for instance, I mean, do you agree that part of the way you pay for this, for all these people that have not been insured, they're going to be insured, is that some people who are currently insured are going to have to pay more, and that a young guy has to now pay for, maternity care and that kind of thing. So, I mean, it may be a better policy, but aren't there some people in that 1 million in California who probably aren't getting junk? They're getting something that worked for them, and now they either can't get it, or they can't get a private policy, and they're going to have to pay more.
Most of the individuals that are getting those notices have plans that don't have what are called the essential 10 benefits or meet the minimum requirement. Yes, it's true, there's going to be a percentage, but let me emphasize it's an extremely small percentage of individuals that are going to pay a little extra. And I think it's estimated less than 1% of that total population, and those are the ones that aren't going to be very happy. But if you look at the success of the overall program as we move forward, and as we get more individuals in the exchange, get more healthy individuals to spread risk and reduce costs, this will move forward, and we will not have this conversation in a couple of years.
What do you think about people who say, let's delay the whole thing for a year? How do you feel about that?
I disagree, because what you're going to end up doing is you're going to have unstable market. The rates won't be set properly. Washington took a leadership role and said, we're not going to do that, we're going to move forward. I think California should do the exact same thing.
Okay, you said that you wish the president hadn't said it the way he did. Yes. Do you think he misled the public?
I don't know if he misled the public. I think he really believes in what he put forward to the Congress to sign. I think it was just an error. I think an error on his behalf.
You've probably seen public opinion polls right now. More than half the people now are against Obamacare. Is it going to turn around, and what would turn it around?
Yes, it's going to turn around. Healthcare reform in this country has always been controversial, from Roosevelt to the Johnson administration, to the Clinton administration, now to Obama. It has always been controversial. When Medicare was signed into effect in the 1960s, it was just, if not more controversial. The American Medical Association, all the physicians that represent the association that represents all the physicians, they said that as soon as this goes into effect, we're going to boycott because they did not want to have socialized medicine. Well, you will not find a physician in this country that doesn't take Medicare now. Mm-hmm. If you were to say we're going to change Medicare and take it away, you'd have a revolution because it guarantees coverage for individuals over the age of 65 who paid into the Social Security system. I'm going to make a prediction. A few years from now, a decade from now, if you were to make those same comments about the Affordable Care Act, you'll have the same reaction. Because once the consumers find out the protections that they have, that they're going to be guaranteed coverage, they will not want to have it taken away from them.
As you know, one of the broader criticisms of the Affordable Care Act is that it addresses insurance and payment. It really doesn't get into quality of care and that sort of thing. Do you agree with that? And are there going to be changes to the Affordable Care Act as we go forward?
You know, I think you are going to see changes. The biggest concern I have is as we legislate to appease an entity or the public with regard to what they're going to be given. So we're giving them an insurance policy, but I think it goes beyond that. We're going to have some bigger problems, not only in the United States, but in the state of California as well, because even though you have an insurance card, not every single person is going to have access to health care. And I honestly believe in California, there's two particular areas that are going to not have access. Rural and inner city, but more in particular in the inner city, communities of color like African American and Latino communities that aren't going to have access to doctors.
Okay,
that's going to be a real problem.
Yeah, it sure is. So maybe we'll be back on talking about that. So anyway, I wanted to ask you something else that I know must be a difficult topic for you, but that's the corruption probes that are going on, some of it right in your backyard. Your neighbor, Senator Ron Calderon, target of the FBI. Both of you have been very prominent in the Latino caucus, in the San Gabriel caucus, which you are the chairman of. So what do you make of all of this? What kind of an impact is it having on the public's perception and just the workings of the state Senate?
Yeah, here's my perception on the impact it's had. First, let's look at what we've accomplished. The state of California is leading the country out of this recession, I believe. Balanced budget, the economy's picking up, lower unemployment, revenues are starting to come back in. We passed landmark legislation in special session. We passed, the local control funding for students. Voters entrusted us with passing Proposition 30. All of this good news and all the good work we've done is kind of being overshadowed by this ugliness. The problem is, I don't know if that affidavit is real. I mean, I'm assuming, and it's all an allegation. But it's sad that all this good work is going to be overshadowed by just one isolated
But when you read about some of this stuff, the alleged bribe taking, and then not Senator Calderon, but another guy who, in a sting operation, takes a council member takes $2 million in money from an undercover agent.
It's sick. It's sick. Yeah. I honestly believe this is a real simple job: is follow the rules and make sure you don't violate the public's trust. It's that simple. And if you do, then you should be held accountable.
Okay. Let's talk, getting back to health care for a moment. And one of the bills that you pushed in this last session was one that would give more powers to nurse practitioners. And it was defeated. Why were you feeling so strong about that, and why did your colleagues not go along with you?
The comment I made earlier about access. In the United States of America, and in particular in California, let's talk about California. 1/3 of the counties in the state of California barely meet the national average of physician to patient ratio. We're going to be now mandating that every single person in the state have health insurance. What are you going to do when somebody in East LA, Compton, Fresno, Central Valley is going to be issued an insurance card that they're going to have to pay for? We're requiring it, the federal government is requiring it, and they can't see a doctor.
So what are some of the things like that a nurse could do that they aren't legally able to do right now?
17 states right now allow nurse practitioners. Now understand that what a nurse practitioner is an advanced practicing nurse who gets a doctorate degree level or a master's degree at a minimum. 17 states in the United States allow nurse practitioners to see patients independently. Currently, in California, they have to see patients through what's called a standards of protocol, working in collaboration with a physician. By allowing a nurse practitioner to practice independently in the state of California, they get on insurance panels, they're safe, effective. There's been decades of data that shows there's no unintended consequences, no excessive malpractice cases, and much better patient satisfaction. We can use that profession like pharmacists.
So you're saying this will help improve care for my constituents, and yet your colleagues, obviously the California Medical Association, the doctors said no.
Right.
So were you just kind of trumped by an interest group here?
Yes, pretty much. But I am committed to bringing this bill back. I am committed to making sure that the public knows and understands that they need to have quality health care. The bottom line is, in organized medicine, they will do everything they can to stop any type of scopes of practice at any professional level, at the national as well as the state level. But these professions are educated. They're the advanced practice of how they've practiced throughout the decades have increased dramatically. And I think it's very, very important that we have provide access to care for everybody in the state of California.
Another bill that you had that the governor vetoed was one that would kind of have brought affirmative action back to the universities. Well, the voters voted on that, didn't they? And they said no more affirmative action, and you want affirmative action. Why is that?
Well, here's the reason why. Is if you look at our UC systems in the state of California, the master plan says that it has to reflect the diversity of the state. That master plan was put in back in the 60s and the 50s. Well, it doesn't. The UCs of the state of California do not reflect the diversity, or the CSUs. I really believe if we're going to look at workforce development, we also have to look at diversifying that workforce development. Let's take the providers as an example. Who better than somebody who comes from that community, an African American, a Latino, the Central Valley, who's a minority, that becomes a dentist, an optometrist, an engineer, a lawyer? Those individuals are more likely to go back. They're going to be more likely to speak that language and have cultural sensitivity to that population. I honestly believe that we need to look at changing Proposition 209. I tried to do it statutorily. I understood that the governor vetoed it because it was in the Constitution. That's why this year I'm running a constitutional amendment that if it gets out of the legislature, to put that question to the voters, to ask them, look, it's time for California to change Proposition 209.
Do you think that's going to happen?
Well, I think I can get it out of the legislature. I think I can put it on the ballot. And if we put it on the ballot, I think that the voters will make that change.
Okay. Well, you're certainly a man with strong views who puts his opinions on the line. It's been great having you on.
Thank you very much.
Senator and Dr. Ed Hernandez,
Thanks
very much.
It's a pleasure.
You can watch this show and past shows at rickreef.com. Segments of the show can also be viewed at pbssocal.org. My guest has been Dr. Ed Hernandez. Thanks for watching. We'll see you again on SoCal Insider.
SoCal Insider with Rick Reef is brought to you by the following. 5 Point Communities is a proud sponsor of PBS SoCal. 5 Point Communities is an independent real estate development company with assets under management across California. More information available at www.fivepointcommunities.com. Snell & Wilmer is a full-service business law firm with more than 400 attorneys in Orange County, Los Angeles, and throughout the West. On the web at swlaw.com. Snell & Wilmer. Straight talk, sound counsel. Practical solutions.
Relief Pod's latest generation of safety kits now go everywhere you go. Relief Pod's organized, color-coded, and compact safety kits keep first aid and emergency items accessible for a safe lifestyle every day. Relief Pod. Live ready.
A healthy future for you, your family, and your business is why Memorial Care Health System transformed healthcare. Our hospitals, physicians, and outpatient centers keep patients healthy and care for them when they're not. Memorial Care, one healthcare system leading the way.
Air pollution can make us sick. Asthma, permanent loss of lung function, even premature death. At UC Irvine, our research is leading to scientifically sound options for reducing pollution and protecting our health.